Hi friends, welcome to the channel The Nurse. Here we are discussing about drug calculations, adult and pediatric drug calculations. Before going to our topic, if you are not subscribed to our channel, please subscribe and it will be helpful for preparing AIIMS NORCET and upcoming JIPMER Nursing Officer exams. So we will go to our topic, drug calculation. So first question. Before going to questions, we need to understand some formulas and conversions. So first formula that is desired dose divided by available dose, that is equal to unknown amount of drug, that is in X, known amount divided by known amount of drug. Desired dose means what is we are planning to give, the dose of medicine we are planning to give, that is desired dose. Available dose means that is the medicines in available quantity. For example, paracetamol 500 mg, one tablet is 500 mg, that is available dose is 500 mg. So one tablet, known amount of drug, that is one tablet, so that is one. Unknown amount, so if you are planning to give 650 mg of paracetamol, but we have 500 mg, in that case the available dose is 500 mg tablet, one tablet. Known amount of drug is one tablet. Desired dose, that is 750 mg we need to give. So in that case, how many tablets we need to give? That is unknown amount of drug. Either it will be number of tablets or milliliter of drug. So in any way it will come. So that is unknown amount of drug. Next, another formula is to find out drop per minute. For that, we need to get solution in milliliter. If it is in liter, we need to convert it into milliliter, and then it is divided by time. Time also it should be in minutes. In question, if it is given in hours, we need to change that time into minutes. To convert hour into minutes, we need to multiply it with the 60. That is 60 minutes. So that is multiplied by drop factor. So these three things we need to get it to find out drop per minute. First is solution, that is required to infuse or administer, divided by time in minutes, multiplied by drop factor. Drop factor may be 15, 20, 60. That is based on the infusing set, IV set. For usual set, it should be 15 or 20. For micro drip set, it will be 60. 60 drop factor means the 60 drops, that is equal to 1 ml. So in micro drip, 60 drops equal to 1 ml. In normal IV set, it will be drop factor will be 15 or 20. That is equal to 15 drops per 1 milliliter. Next, we need to understand some conversion. To convert pound to kilogram, we need to divide the pound by 2.2. To convert pound to kilogram, we need to divide the pound by 2.2. And need to understand some other terms also. 1 ounce. Sometimes in pediatric setups, we need to change the amount. 1 ounce. The question it will be mentioned like 1 ounce. So we need to convert it into milliliter. So 1 ounce equal to 30 milliliter. 1 pint. 1 pint equal to 454 milliliter. 1 kilogram approximately, that is equal to 1000 milliliter. 1 kilogram, that is approximately equal to 1000 milliliter. So these terms will apply it into questions. So first question, the nurse caring for a patient with a suspected renal dysfunction calculates that the patient's weight has increased by 5 pounds in the past 24 hours. The nurse estimates that the patient has retained approximately how much fluid? In this question, it is given the weight increase, that is in pounds. 5 pounds weight increased in last 24 hours. So the nurse has to estimate how much fluid retention in that patient. Options: 1300 ml of fluid in 24 hours, 2300 milliliter of fluid in 24 hours, 3100 and 3100. So here correct answer will come 2300 milliliter of fluid in 24 hours. So we will check how we can solve this question. So an increase in body weight commonly that accompanies edema, that is indicates fluid retention. The body weight increase that is due to fluid retention. So we need to estimate the amount of fluid. First, we need to understand the 1 kilogram weight gain, that is equal to 1000 milliliter of fluid. But in the question, it is mentioned 5 pounds increased. So we need to convert the pounds into kilogram. So 1 pound is equal to 454 gram. So 5 pounds is equal to 2.27 kilogram. 2.27 kilogram. If 1 kilogram is equal to 1000 milliliter of fluid, 2.27 kilogram, that is equal to 2270 milliliter. But in the options, there is 2300. So that is somewhat equal to 2270 milliliter. So we can select 2300 as answer. So I think that is clear. Best thing is you can take a pen or pencil and write it down. Then only you can understand. Without writing, you will not get that solving skill. So please write it down. Then you will be able to solve the questions easily and very fast. Next question: meperidine hydrochloride 75 mg intramuscular stat is ordered. The label on the available medication reads meperidine hydrochloride 50 mg per milliliter. How much should the nurse administer? This is direct question. If you having some trouble in solving this question, you need to write it down and you apply the formula. Then you can solve the question easily. Options: 1 ml, 1.5 milliliter, 2 ml, 2.5 milliliter. Here correct answer is 1.5 milliliter. So we will go to the solutions. So here we need to, the desired dose is 75 milligram. But available dose, the meperidine available dose is 50 milligram per ml. Each ml contains 50 milligram. So we will apply these values in our this formula, that is desired dose divided by available dose equal to unknown amount of drug, that is X. We will denote it as X, divided by known amount of drug. Desired dose, that is 75 milligram. Available dose, the meperidine is available 50 milligram per 1 ml. So known amount of drug is 1 ml and unknown amount we need to find it out. So desired dose 75 mg divided by 50, available dose equal to X, that we need to find, divided by 1 ml, 50 mg per 1 ml. So if we are solving 50 cross multiply, that is 50x equal to 75, then x equal to 75 divided by 50 equal to 1.5 ml. So this way we can solve the question. Actually it is an easy question, but you need to write it down. If any difficult question comes, means you cannot able to solve it in your mind, so you need to write it down. So that is why I am asking a pen or pencil and make a note. Third question: a 132 pound adult is to receive HICIT 5 milligram per kilogram orally, divided into 3 equal dose. Each HICIT tablets contain 50 milligram per dose. How many tablets would you administer per dose? 2 tablets, 4 tablets, 6 tablets, 8 tablets. this question is little confusing type. So you need to solve it according to our steps. So first you need to understand the weight of the patient adult is given in pound. So you need to convert the pound into kilogram. And next thing is the available the required dose, that is 5 milligram per kilogram orally. So each kilogram of body weight, each kilogram of patient, that required 5 milligram per kg. And another thing is that total dose is divided into 3 equal dose, that is TID. So first we need to find the total daily dose, then we need to find it the TID, the each dose of drug. The available tablet is 50 milligram. So we will check the answer here. So each dose contains 2 tablets. We will solve the question here. To convert the pound into kilogram, we need to divide the pounds by 2.2. So total patient's weight is 132. To convert 132 pound into kilogram, we need to divide by 2.2, that is equal to 60 kg. So daily dose, that is calculated by 60 kg multiplied by 5 milligram per kilogram. So if you are solving this term, we will get 300 milligram. So total daily dose is 300 milligram. But in the question, we need to administer 3 equal dose per day. That is TID. To find out the single dose, that is we need to divide the daily dose divided by frequency. Frequency, that is 3 dose. So 300 divided by 3, that is equal to 100 mg TID. So we got 100 mg TID. But available dose, the required desirable dose is 100 mg. Available dose, that is 50 mg one tablet. Then we will apply that values in a formula. Then we will get X equal to 2 tablets. So each dose we need to administer 2 tablets. 2 tablets TID. Next question. A 22 pound child is to receive digoxin. The daily dosage is 0.012 milligram per kilogram in divided dose at 12-hour interval. 12-hour interval means BD dose. On hand is digoxin elixir 0.05 milligram per milliliter syrup. Options 0.05 ml, 1.2 ml, 2 ml, 2.4 ml. Here also the weight is given in pound. So we need to convert the pound into kilogram. And the daily dosage is 0.012 milligram per kilogram. And first we need to find out the daily dose of according to patient's weight, child's weight. Then we need to administer it in a 12-hour interval, that is 2 divided dose. Available digoxin syrup, that is 0.05 milligram per milliliter. So this much values we have in our hand. So we need to solve the question. So our answer will come 1.2 milliliter of syrup, digoxin syrup. So we will go to the solution. I told the weight is given in pound. So we need to convert the pound into kilogram. 22 pound divided by 2.2, that is equal to 10 kilogram. The child weight is 10 kilogram. Then we need to find total daily dose, 10 kilogram multiplied by 0.012 milligram per kg, that is given in question. Then we will get the daily dose is 0.12 milligram per day. But in question, it is asked to give in 2 equally divided dose, that is 12-hour frequency. To get a 12-hour frequency dose, that total daily dose is divided by 2. 0.12 divided by 2 equal to 0.06 milligram per dose. Each dose that is 0.06 milligram. Then available, then we need to check available dose. The required desirable dose is 0.06 milligram. That is each dose. Available that drug is 0.05 milligram. The digoxin available dose is 0.05 milligram. That is given in question per 1 ml. 0.05 milligram per 1 ml. Then we will apply these values here and cross multiply. That is 0.05x equal to 0.06 milligram. Then by solving this, x equal to 0.06 divided by 0.05, that is equal to 1.2 ml per dose. To get 0.06 milligram, we need to administer 1.2 ml digoxin. I think it is clear. Then we will go to next question. Infusion of 500 ml normal saline over 6 hours requires how many drops per minute when the drop factor is 15 drops per minute? 23 drops per minute, 21 drops per minute, 17 drops per minute, 15 drops per minute. So here we need to apply the drop per minute formula. So correct answer will come 21 drops per minute. We will go to the solution. Here the total amount of solution that is given in milliliter, that is 500 milliliter, but time duration that is given in 6 hours. So we need to convert hours into minutes. For that we need to multiply 6 with 60 minutes. Then we will get time duration. And another value we needed, that is drops per minute, it is 50. So we will go to our solution. The formula to find out drops per minute, that is total volume in milliliter divided by time in hours into 60. Time in hours to convert in minutes, we need to multiply with the 60. Then we can apply the values. The total volume is required to administer, that is 500 ml. The time duration 6 hours multiplied by 60, then we will get in minutes. So drop factor is 15. In this question, we can cancel 0 from 60 and that cancel with 0 from 500. Then we will get 50 into 15 divided by 36. 50 into 15, that is 750. Then divided by 36, that is equal to 20.83. That is somewhat similar to 21 drops. By rounding of 8, it will come 21. So 21 drops per minute, that is the answer. Next question. A client is to receive 1000 milliliter of dextrose 5% in water over 8 hours. Here also given in hours. The drop factor is 12 drops per minute. At what rate should the IV be running? Here we need to administer 1000 milliliter and over 8 hours. So we need to convert the 8 hours into minutes. 8 into 60. Here drop factor is 12. The options 100 drops per minute, 125 drops per minute, 25 drops per minute, 50 drops per minute. Here correct answer will come 25 drops per minute. We will go to the solutions. How to find this answer? Once again, the total amount is need to infuse, that is 1000 milliliter. The duration, the time duration is 8 hours. So we need to convert 8 hours into minutes. So 8 into 60. So drop factor 12 drops per minute. So all the values available here. So just we need to apply it. Formula drops per minute equal to solution in milliliter divided by time multiplied by drop factor. Here solution in ml, that is 1000 milliliter divided by 8 hour. We need to convert it into minutes. 8 into 60 divided by 12 multiplied by 12. Here also we can cancel this 0 with this 0 and then it will come 8 into 60, 8 into 6, that is 48. 100 divided by 48 multiplied by 12. Then this 12, it will go to 48. 48 means that is 4. Then it will come 100 divided by 4. Answer will come 25. So I will explain that is in detail. So 100 divided by 48, that will be 2.0833 milliliter per minute. That is multiplied by with this drop factor. Then answer will come 25. 25 drops per minute. No need to write this much. So just for explanation purpose only, I have written all the steps. Then you can find it out easily. From here itself, we can solve the, we can get the answer. But I have gone one more extra steps to understand. Seventh question. A nurse is to administer promethazine, that is Finargan, 12.5 milligram intramuscularly start to a client. The medication is applied to an ampule of 50 milligram per milliliter. How many milliliter should the nurse administer to the client? Here, that desired dose is 12.5 mg. But available dose, that is 50 milligram. So, how many milliliter should the nurse administer? Options 0.125, 0.25, 0.3, 1 ml. Correct answer is 0.25. We can find it out in your, we can calculate in your mind itself, but I will show you the detailed solution. Here, the formula we need to use, that is desired dose divided by available dose. Desired dose, that is 12.5 mg. Available dose 50 mg per ml. So known amount is 1 ml. Available dose is 50 mg. We need to find it out x. We will apply the values here. 12.5 mg divided by 50 equal to x by 1 ml. That is cross multiplying 50x equal to 12.5 mg. X equal to 12.5 mg divided by 50 equal to 0.225 milliliter. So after just write it down and solve, but no need to write all the steps. You can solve it easily. So from here itself we can solve. X by 1 ml equal to x only. So no need to write these steps. We can directly get the answer. Next question. A client is to receive cephalexin 500 mg in 50 ml of normal saline IV. The medication is to be infused over 20 minutes. To correctly infuse the medication, the nurse should set the pump rate at dash milliliter per hour. So in this question, 50 ml of solution need to administer in 20 minutes. So pump rate we need to convert it into per hour. Milliliter per hour. Here options 100 milliliter per hour, 20 milliliter per hour, 60 milliliter per hour, 150 milliliter per hour. To convert minutes into power, to convert that minutes into hour, we need to multiply with 60. So here correct answer will come 150 milliliter per hour. So we will go to the solution, how to find it out. So here there are 2-3 methods. So first method is you write it the values as a proportion. That is 50 ml we need to administer over 20 minutes. That is equal to x ml. That we need to find it out over 60 minutes. 60 minutes because it is we need to convert per hour. That is why 60 comes. So while solving, we need to multiply with inside values. Inside values means 20 and x, that is inside value. Then extreme values. Extreme value, that is 50 and 60. So our equation will come 20x. 20 multiplied by x, that is 20x equal to 3000. 3000, that is 50 into 60. equal to 3000. By solving it, x, that is 3000 divided by 20 equal to 150 milliliter per hour. That is one method. So if this method is confusing, means you can go with another method. That is, you just write 50 ml per 20 minutes. So 50 divided by 20 minutes, that is equal to x, that is that rate of infusion, we need to find it out, divided by 60 minutes. 60 minutes means 1 hour. Then we will get this solution again by cross multiplying with a decimal. 20 into x, 20x equal to 50 into 60, that is 3000. And one more method is, that is 50 ml by 20 minutes, that you can write 50 ml, we need to administer 20 minutes. So we need to find it out. So 20 minutes to get 60 minutes, we need to multiply with 3. So by multiplying here 3, we need to make the 3 multiplying with 50 ml also. Then the equation will be correct. So 50 into 3, 150 ml, 20 minutes per multiplied by 3, that is 60 minutes. 60 minutes equal to hour, 1 hour. 150 ml per 1 hour. So these 3 methods you can apply. First one is, this is first method. Next method is this one, 50 ml divided by 20 minutes. Then you can cross multiply, or this third method. Any one method you can apply here. You will get the answer. Next question. Calculate the dose of amoxicillin suspension in milliliters for otitis media for a 1-year-old child weighing 22 pound. The dose required is 40 milligram per kilogram per day divided by BD dose, and the suspension comes in a concentration of 400 milligram per 5 ml. Here available dose is 400 milligram per 5 ml. First we need to find it out, the daily dose, then we can apply the formula. So options 1 ml, 1.5 ml, 2 ml, 2.5 ml. Correct answer, that is 2.5 ml. Then we will go to the solution, how to find out the answer. First we need to convert the baby weight into kilogram. So 22 pound is equal to 10 kilogram. 22 pound divided by 2.2, that is equal to 10 kilogram. Then we need to find out the daily dose. To get the daily dose, 10 kilogram baby's body weight multiplied with the required dose, 40 milligram per kilogram per day. It will come 400 milligram per day. But the daily dose should be equally divided into 2 doses. That is BD. To get the dose, we need to divide the daily dose by frequency, that is 2. 400 mg per day divided by 2 equal to 200 mg per dose. 200 mg we need to administer each dose. Convert the milligram dose to milliliter. 200 mg per dose, that is divided by 400 milligram per 5 ml. That is 400, if you are solving this one, 80 milligram per ml will come. That is 200 milligram. To get the 200 milligram, we need to divide 200 by 80. That will come 2.5 milliliter. Each dose we need to administer 2.5 milliliter. Then we will get the 200 milligram dose. 2.5 milliliter is equal to 200 milligram. Next question. Calculate the dose of ceftriaxone in milliliters for meningitis for a 5-year-old weighing 18 kilogram. Here directly they have given weight 18 kilogram. The dose required is 100 milligram per kilogram per day, given IV once daily. That is, we need to administer once daily, and the drug comes pre-diluted in a concentration of 40 milligram per ml. Available dose is 40 milligram per ml. Options 35 milliliter, 45 milliliter, 50 milliliter, 55 milliliter. Correct answer 45 milliliter. We will go to the solution. How to find out the answer. First, we need to calculate the daily dose. To calculate the daily dose, weight multiplied with the required dose. That is 18 kilogram baby's weight multiplied with 100 milligram per kilogram per day. Then you will get the daily dose of medication. That is 1800 milligram per day. We need to administer 1800 milligram per day once in a day. So divide the dose by frequency. So it is a once OD dose. So 1800 milligram per day divided by 1. It is equal to 1800 milligram per dose. To get 1800 milligram per dose, we need to divide with 40 milligram per ml. That is available dose. If you are solving, we will get 45 milliliter. That is the required dose. 45 milliliter, that is equal to 1800 milligram. Then we will go to the last question. An IV ranitidine 50 mg per 50 ml dextrose 5% in water to run over 30 minutes. If the drop factor is 15 drops per minute, how many drops per minute will you set on the IV infusion machine? 20, 25, 50, 75. Correct answer here, that is 25. So we will go to the solution, how to find out the answer. We need to apply drops per minute formula here. First we need to find out solution in ml. Then it is divided by time multiplied with the drop factor. Everything given in question. That is solution, total amount of solution that is required to give, that is 50 ml. Then time duration is 30 minutes. So here directly it is given in minutes only. So no need to multiply with the 60. And the drop factor is 15. So by solving, 15 will go into 30, that is 2 times. Then 50 divided by 2, that is 25. So directly you can find out the answer here. Correct answer is 25. Otherwise you need to write it 750 divided by 750 means 50 into 15. 750 divided by 30. Then also you will get to the answer 25. So correct answer is 25 drops per minute. So that is about today's video. So if you have any doubts means you can ask in comment section. I will try to solve. Then thank you for watching this video. Please like and share with your friends. Bye bye.